Portugal has started easing coronavirus restrictions after a strict lockdown that lasted more than 2 months. Cafes, museums, shops, they can now welcome back guests under strict hygienic guidelines. It's a comeback story for Portugal, which back in January had one of the highest coronavirus infection rates in the world. DW's Jan-Philipp Schultz went to the capital, Lisbon, to see how they did it.
Sitting in a cafe with friends, still a dream for millions, possible again in Portugal. Nearly everyone spent the last 2 months at home. This was forbidden. But now shops, primary schools and cafes are open again, and people are delighted. It feels almost euphoric simply to be able to sit here and watch people walk past. I was in no way against the lockdown. It was very important. But I think we now all really need to be able to enjoy life again instead of just going to work and then looking at our own four walls. What I missed the most was just looking out at the water and drinking a beer. Central Lisbon looked like this for the last couple of months. Everything was closed. The government ordered most people to work from home. A radical lockdown in response to a disaster. Portugal had the world's highest corona infection rates. The health system couldn't cope. Intensive care units were overwhelmed. Lockdown took daily infection numbers from more than 12,000 at the start of February to fewer than 400 just 9 weeks later.
Here, outside Lisbon's largest hospital, more than 40 ambulances had to wait in line in front of the emergency ward during the worst days of the pandemic. Now, only a few COVID patients have to be treated in the intensive care unit, and a field hospital on the other side of the street was closed weeks ago. Some observers are already talking about the miracle of Portugal.
Baltasar Nunes believes more in science than miracles. An epidemiologist, he's a member of the Portuguese government's Corona Advisory Group. He says one of the most unpopular lockdown measures could have been decisive. The numbers went down somewhat when we first closed the shops and made remote working compulsory. But it was only when we closed all the schools that the infection figures really started to fall. He says despite the progress, the danger is not over and the pandemic will continue to affect people's lives even into the next year. And the lockdown was tough on the economy, pushing unemployment up by a third. Right now, though, many Portuguese people are enjoying a moment in the sun.
Well, despite half a year of restrictions, Germany is still struggling to contain a third wave of coronavirus infections. The high caseload is fueling calls for a tougher lockdown, but some German states are experimenting with easing restrictions.
A quick test and activities like sport and cinema visits are allowed again. Saarland in Western Germany has become the first state to start loosening restrictions. Elsewhere, scientists and some politicians are calling for stricter measures. Among them, Chancellor Merkel's Conservative Party leader, Armin Laschet. He's suggesting a temporary tightening of restrictions until enough people have been vaccinated. Until that point in time, and we are talking about 2 or 3 weeks, we should make another effort to limit public life. Laschet's comments have been met with criticism also from the opposition. For over a year, the only thing policymakers have been able to come up with is shutting down public life, telling people to stay at home, locking down, selling the same old policy with new slogans. Authorities are hoping to accelerate the country's sluggish vaccine rollout by allowing 35,000 general practitioners across the country to start administering the jabs this week. But in the capital, Berlin, the vaccination effort has experienced a further snag, with deliveries delayed by what authorities called technical problems. 2 vaccination centres had to close on Tuesday because they ran out of doses. Frustrated by the situation, people in Germany are calling for a unified approach. The way the third wave is looking, it will be even more devastating than the second. That's why I think there will be another hard lockdown. Politicians somehow can't seem to come up with anything else. They will just lock down until everyone is vaccinated. We should first implement the measures they've already agreed upon. They keep changing the rules, then they disagree, then everyone does their own thing. It's hard to understand. If our leaders manage to stop arguing, then there will be a hard lockdown. There's probably no other way to solve it. But the country's federal political system is getting in the way. Ultimately, it's the states that decide on and implement the measures. For now, Chancellor Angela Merkel is not intervening. But she has warned that, if the situation demands it, she could try to take matters into her own hands.
And DW political correspondent Thomas Sparrow joins us now from Berlin. Thomas, ICU staff in Germany are warning that there are not too many beds left. How hard is this third wave hitting the country?
It is certainly hitting the country very hard, in particular because of the more prevalent coronavirus variant, which has been described as more contagious and contagious also for longer, and which has led, Sarah, to an increase in the number of coronavirus cases here in Germany, and also, by the way, to a growing debate about what path the country should take in the next few weeks and in the next few months. This is, by the way, a debate and a situation that is not only happening here in Germany, also in other European countries and in many of Germany's neighbouring countries as well, which only makes the situation here in this country more and more difficult and more challenging. There are a few caveats, a few good news as part of all this situation. One of them being that the number of deaths have been going down, and also a positive development when you look at the infections among Germany's older population. But all in all, the situation is certainly very difficult when it comes to this third wave of the coronavirus pandemic.
And it's taking place, the pandemic, we have to say, against the backdrop also of federal elections that are coming up later this year. Tell us, in terms of management of the pandemic, how politicized has it therefore become, Thomas, and how is that potentially impacting the prospect of further lockdown measures?
Well, it has always been political right from the start, but it is important to stress now that it's becoming more and more political, more and more intense as Germany gets closer to that all-important federal election in September, which will decide the successor to Angela Merkel in the German chancellery. And obviously, all parties involved, all candidates involved are trying to position themselves appropriately when it comes to deciding what path Germany should face in the next few weeks. And in particular, Sarah, to decide a very important dilemma that politicians are facing, whether the country should carefully, cautiously open up, or whether further and stricter restrictions should be in place to try and deal with this third wave of the pandemic.
Thomas Sparrow in Berlin. Thank you. U.S. President Joe Biden says that all adults in the United States will be eligible to get a coronavirus vaccine by April 19th, 2 weeks earlier than the previous government deadline. He warned, however, that cases are still going up for the moment, urging people to get vaccinated as soon as possible. In New York State, everyone older than 16 can already get a shot.
Relief for 3 teenagers who know how dangerous COVID-19 is. Hannah's whole family got sick with the virus last year. Paul loves playing for his wheelchair high school basketball team, but going back to school threatens his health. And Brianna has a rare condition, sickle cell anemia. Vaccination is a matter of life or death for her.
I feel like at the end of the day, as long as you have some sort of protection against the deadly virus, it's all worth it in the end.
Downtown New York City. It's not bustling, not yet at least. But an estimated 1 in 3 New Yorkers has now been vaccinated, which means there's a feeling of reawakening this spring.
I think there's a new found sense of optimism in the past month in New York, for sure.
My family is from Germany, so they're still in a lockdown, and my parents didn't even get the shot yet, so it feels kind of weird that I already got it here.
At a church near Washington now being used to vaccinate people, applause for the US president. Joe Biden came here to tout the hundreds of millions of doses set aside for Americans.
But Carl, you probably came and wanted a shot, and Biden's holding you up here.
The US has already given a first dose to more than 150 million people, but tens of millions more are still waiting.
By no later than April 19th, in every part of this country, every adult over the age of 18 or older will be eligible to be vaccinated.
Not everywhere in the US is advancing so rapidly. In sunny California, adults over 50 only became eligible at the start of the month. But here too, the effects of the vaccination program are visible, with Los Angeles reopening and crowds gathering at this flower festival near San Diego. It's not the end of the pandemic, not yet, but much of the world can only dream of pleasures like this.
Amnesty International's annual report says that COVID-19 has further amplified massive global inequalities, and it accuses many world leaders of using the pandemic to crack down on human rights. Now, the report singles out 3 groups that have been disproportionately affected. First, women. They have suffered an increase in domestic violence, borne the brunt of homeschooling, and in many cases lost their income because they had informal jobs that they couldn't do under lockdown. Second, healthcare workers. Around the globe, they have suffered more fatalities than any other group. Chronic underinvestment in health systems means many hospitals are understaffed and their workers are not sufficiently protected against the virus. Finally, the third group, the pandemic, also worsening the already precarious situation of refugees and migrants. Lockdowns and border closures have left some trapped in squalid camps without access to vital supplies. Let's go now to Johannesburg and speak with Netsanet Belai. He is a research and advocacy director at Amnesty International. Welcome to the program, and thank you so much for joining us. This report saying the world's most vulnerable, marginalized people have borne the brunt of the pandemic. How bad is the situation?
It's as bad as it gets, Sarah. We believe that those who gave us the most were protected the least, and those who were marginalized were really exposed the most. And you cited some of the examples. Let's take a look at the situation of refugees and migrants. In far too many countries, the precarious situation in which refugees and migrants was even expanded by this pandemic. Take a look at the example from US border with Mexico, where over 500,000 refugees and migrants were expelled from the country, including the 13,000 unaccompanied children. Let's go to Uganda, a home for 1.4 million refugees, has closed its borders, stranding over 10,000 refugees along the border with DRC. And the other aspect is the impact on informal workers, those working in the gig economy, our cleaners, our seasonal workers, who are left without any income or social protections to do that. And mind you, most of these are also women who take care of families but were left without any social protection in that regard. And speaking of women and girls, 2020 also showed us a marked increase in domestic violence as a result of lockdowns, following the lockdowns, because of lack of adequate protections by governments. Right. I mean, in Nigeria.
I just wanted to ask you, I mean, what you're describing here, you're painting this picture of this huge human impact. Another wrinkle in this report that Amnesty has documented is the fact that governments using the coronavirus to stifle dissent in their countries. Walk us through that aspect of this story. Who are the biggest offenders there?
There are many in the list, Sarah, it's as if a violent trade of leader has emerged that weaponized COVID to launch fresh assaults on human rights. Let's take example from Hungary, which introduced a new law criminalizing any false dissemination of information about COVID to prison terms to 5 years. Zimbabwe introduced a similar law, but only the sentence is 20 years than the 5 years. Many countries have actually resorted to excessive and brutal police force to enforce COVID regulations. Zimbabwe, over 116,000 people were detained for violating COVID regulations. Others, like China and India, have actually used the COVID as a distraction to perpetuate and escalate clampdown on dissent and minorities. India is one of those who have went on a rampage to crack down on civil society activists, including using anti-terrorism laws and etc. In China, the situation with Uyghurs is further escalated following the crisis, many being persecuted as has been widely reported. So these are the kind of pattern that emerged in far too many countries where governments have used COVID as a pretext.
And we thank you so much for joining us to tell us a little bit more about that. Netzanet Belai, Research and Advocacy Director at Amnesty International, as your organization releases its annual report. Thank you for joining us to share the findings.
Thank you, Sam.
Well, Brazil has reported more than 4,000 new daily deaths from COVID-19 for the first time. The nation's pandemic death toll is now approaching 340,000, second only to the United States. Experts say that a local variant of the virus has caused the latest surge, which has pushed the healthcare system into a breaking point. Right-wing President Jair Bolsonaro has also opposed lockdown measures as damaging to the economy. But many of Brazil's poorest citizens are crying out for help. They say the government's pandemic response has failed them, and without more aid, many risk going hungry.
These protesters are sending a message to their government. Brazil is hungry. Here in Sao Paulo's largest favela, Paraisópolis, residents say emergency aid doesn't go far enough. My fear is that my daughters will go hungry, one of them still under 18. There's also my granddaughter, and I think to myself, will they go hungry? Up until December, the Brazilian government provided those in need with around €90 per month in aid. Community centres like this one have been offering free meals, but donations have dropped. President Jair Bolsonaro's administration is once again offering help, but a more modest amount. A community movement known as G10 is demanding more. The emergency aid of €23 is enough to buy a domestic gas cylinder, 5 kilograms of rice and 1 kilogram of beans. A family can't survive a month on that. It's shameful. Brazil is a rich country and letting its population go hungry. And the pandemic is still out of control. Brazil is a country in crisis, and there's not much light on the horizon.
Some other developments now in the coronavirus pandemic. In France, the number of patients in intensive care is at its highest in almost a year. France is now in a month-long lockdown. India has hit another new record number of daily cases. New Delhi, Mumbai, and dozens of other cities are imposing curfews to try and slow the soaring infections. And a top official at the European Medicines Agency says there is a link between the AstraZeneca vaccine and rare blood clots. The agency is expected to release a new assessment of the drug this week.